guys. I am going to demonstrate several different techniques and ways to care for a patient in bed, getting out of bed, and then also placing an NG tube. So right here I have an older patient. First thing I'm going to do when I walk into the room is ensure privacy, close the curtain or the door. I'm going to perform hand hygiene, and this patient has requested to get on the bedpan. So I'm going to show how we would do that. Basically, I would come in and announce myself. My name is Danny. I am with the Butler Nursing Program, and I'm going to go ahead and assist you with getting on the bedpan. I would then verify the patient's name and date of birth, as far as their hospital bracelet, just to ensure that I have the right patient. I would glove up, and the first thing that I'm going to do is lower the bed all the way down so they're laying flat. It's going to assist and help with rolling them, as well as keeping my safety intact, my back and everything. It's a lot harder to roll somebody when they're obviously sitting upright. I'm going to bring the level of the bed up so that I'm not bending over too far. And then I'm also going to take this bed rail down so that nothing is in my way when I try to roll this patient. I'm going to go ahead and explain to the patient what I'm doing, let them know that I'm going to go ahead and move the blanket down while still ensuring privacy. I'm going to go ahead and remove the pillow while holding the back of the head, making sure the patient is still comfortable. I have my bedpan. So what I'm going to do, if the patient is able to assist, I'm going to go ahead and ask them to bend the knees, reach with the opposite arm for the other bed rail, and roll onto your side. If the patient is not able to help, or if the patient is harder to roll or overweight or unconscious, I would obviously bring in other help to assist me, but I think I can get her on my own. So what I'm going to do is place the bedpan under her buttock and make sure nothing's pinched. Roll the patient back. I'm going to cover the patient back up. Sometimes I'll put a wet pad or something like that in between the legs, especially for females, because we tend to shoot out sometimes, and then we do a whole bed change after that. So we're just going to go ahead and pretend I didn't put anything there, and then we'll move on to a full bed change. So I'm going to sit the patient's head back up, put the pillow back, give her her call light. Let me know if there's anything I can get you right now. Let me know when you're finished on the bedpan. I am going to take my gloves off, hand hygiene, ensure privacy, and exit the room. So the patient has called me back. Patient's done on the bedpan. Same thing. I'm going to come in. I'm going to bring the bed back up. I'm going to lower the head down, remove the pillow. Still ensuring patient privacy, I'm going to roll the blanket down, and we're going to roll the same way as we did before, okay? So let's go ahead and roll. Pull the bedpan out. I'm going to set it off to the side, and I'm going to cover it with a towel. I will put the patient's, I will deglove and hand hygiene, and then I will put the patient's head back up, pillow back in place, cover the patient back up. If the patient's able to wipe, I normally will leave them wipes while I am out of the room. If they're not, then I will clean them from front to back when I remove the bedpan. It's usually easier when they're rolled onto their side, if they've had a bowel movement, obviously, to clean them at that time. Discard of the contents in the bedpan. If it's urine and if it's a BM, I'm going to look at the color, consistency, smell, and I'm also going to measure especially the urine, and measure the output so that I can document these findings after I'm finished. So I will discard of the bedpan. I'm going to put this bed rail back up. If the bed alarm is supposed to be on, I will put the bed alarm back on. I will lower the bed all the way down. I will make sure the patient is comfortable, get their head positioned in whichever way is comfortable for them. Give them back their call light. I will perform another hand hygiene, ensure privacy, and exit the room. So in this situation, I'm just going to go ahead and show how we would change an occupied bed. I'm just going to say that this patient's bedpan spilled over or something like that happened. So basically what we would do in that situation, same thing, come in, ensure privacy, hand hygiene, gloves. Obviously, I would need a new bed sheet, pillowcases. A full bed change is a full bed change. So I like to change the entire thing while I'm in there. Might as well, especially if it hasn't been done that day yet for the patient. So the same thing I'm going to do. I'm going to raise the bed up to ensure safety of myself and my back. I'm going to lower this bed rail down, and I'm going to lower the patient's head down because we are going to do a log roll on one side and on the other side. So like I said earlier, it's going to be easier if they're laying flat. In some situations, if the patient can't lay flat due to a specific type of surgery, or obviously if they're having trouble breathing, if they're oxygenated, that's different. But this patient's doing just fine, so I'm going to go ahead and lay her flat and remove the pillow. I'm going to discard of anything dirty. So the first thing you're going to do is you're going to remove the edges of the sheet on the side that you're on and roll them. We're going to work from one side to the other. So I'm going to go ahead and just do this bed change on my own since this is an easy patient. So what I'm going to do is have her bend her legs, reach over to the side for me. Side rail, hold on to that, hold that position, and I'm going to tuck these sheets underneath her. And I'm also going to place new sheets here in our open area. And I'm going to tuck them as well underneath the soiled sheet. If the sheet is soiled enough to where it's going to get on my new sheet, I'll place bed pads in between the two and tuck them in so that I maintain my new sheet's cleanliness. Have it all tucked in. I've got 2 bed pads tucked in here to make sure we don't have this issue next time. And what I'm going to do is tell the patient, I'm going to have you roll to your other side. You're going to have a little lump underneath you, so just be prepared for that. I'm going to help you. In this situation, I would obviously be on the other side of the bed, but it's not set up that way. So excuse my bending over, but I'm going to have you roll to the other side. Very good. Reach for that rail. And then I'm also obviously going to discard of the dirty sheet, and I'm going to pull the clean sheet through and the pads through. I'm going to discard of all anything dirty that's on the bed. We have new sheets down for this patient, so I'm going to go ahead and roll her back onto her back. I'm going to cover her up with the new blanket. Make sure she's comfortable. I'm going to go ahead and sit her head back up. Give her her pillow back and her call light. I'm going to put the bed rail back up, lower the bed back down. Make sure there's nothing else she needs before I leave the room. And that's how you change a used bed. The next thing that I'm going to demonstrate is how to place an NG tube. So the first thing that I'm going to do for the NG tube is obviously hand hygiene. I'm going to ensure privacy. I'm going to wear gloves. I'm going to identify myself and have the patient use 2 identifiers. But for an NG tube for an adult, what we're basically going to do is I'm going to have her sitting up in the high Fowler's position. And I'm going to take the NG tube to the nares. What I'm going to do first is check for any polyps or anything in the nares, make sure everything looks good. I'm going to take the tip of my NG tube to the nose, and we're going to measure to the middle of the ear. And from there, we're going to measure down to the xiphoid process. And for adults, you're going to add 10 centimeters or about 4 inches to ensure that you have enough room. So I'm going to go ahead and go down a few more inches here. Then I'm going to mark it off. To place the NG tube, I would like to tell the patient to take a deep breath before I insert it, but I'm obviously going to make sure that they know what I'm doing, how I'm doing it, and to let me know if at any point it's uncomfortable, or that, I guess it would be uncomfortable, but at any point if it's unbearable, I should say, that I can stop. But so basically what I'm going to do is I'm going to insert through the nair, take a deep breath for me, and I'm going to slide, push, push, push. If it's inserted correctly, I'm going to tape it off to the side. out of the way, tape it to their nose. X-ray is going to come through and make sure it's where it needs to be, and that the patient is comfortable. Until then, I will obviously have the patient let me know if they need anything. Sometimes if you're having trouble inserting the NG tube, you can have the patient swallow multiple times while you're trying to get it down, so that way you can kind of see that it's being inserted correctly. I will lower the bed back down. I will put the bed rail back up, give them their call light, make sure they don't need anything else, and then I will remove my gloves, hand hygiene, ensure privacy, and I will leave the room. The next thing that I'm going to do is show how to do a transfer from the bed. And what we are going to do with this patient, she would like to go on a little walk. So I'm going to come into the room, identify myself, 2 patient identifiers, hand hygiene, privacy. What I'm going to do is assist the patient, and I'm going to give her direction as we go. So I'm going to remove the bed rail, and depending on the patient's state, different types of surgeries. In this case, my patient has had a back surgery, so she has certain ways that she needs to move around in bed, as far as no twisting or bending. So I'm just going to go ahead and let her know that we're going to make sure her bed is laid flat. We're going to remove the covers out of the way, and the first thing that we're going to do with trying to get up is roll onto her side. So we're going to roll onto her left side. And what she's going to do is she's going to push off this left elbow while using this knee to also push herself up. So basically her legs are coming out as she's pushing up, and she's pushing up off this left elbow to ensure that she doesn't bend or twist her back. So on the count of 3, 1, 2, 3. We'll get to the edge of the bed here. How do you feel? Dizzy, nauseous, short of breath? Okay. So I'm going to put my gait belt on. Ooh, stay up, lady. Obviously around the waist here. And I will loop it. And what I'm going to do is assist the patient in standing. So the first thing that we're going to do is we're going to do a countdown. I'm going to let her know on the count of 3 we're going to stand. Use as much weight in those legs as you can. We really want to put those legs to work. We can push off from the bed with our hands, using that weight on your hands as well. And on the count of 3 we're going to stand up, okay? 1, 2, 3. Perfect. That whole time I have a hold of her gait belt, obviously to assist with helping her stand, but to make sure that we're not wobbly and falling over. So we went on a walk, and we are back now. Held onto her gait belt the whole time. She did fine. No blood pressure problems, no short of air, nothing like that. So what we're going to do is we're going to go ahead and get back in bed. So I'm going to have the patient sit. We're going to sit with a straight back. We're going to bend at the knees, and we're going to sit very slowly. Okay. I'm going to go ahead at this point, remove the gait belt. And I'm going to assist the patient in laying back down. So we're going to do the same thing that we did before. We are going to come down onto this left elbow. While we do that, we're going to bring the legs up at the same time. So on the count of 3, 1, 2, 3. So we're on our side, and then we're just going to roll onto our back. Okay, so I'm going to make sure the patient's comfortable on her pillow. Make sure the patient doesn't need anything. Give her the call light, lower the bed if it's been up. Raise the head if she needs the head raised. Put the rail back up, and we should be good to go.